Working Lady podcast, we put in the work. Our work goes hard on nutritional health. I'm Clary, your certified precision nutritional health coach, here to help you transform yourself. All right, ladies, I want to thank you so much for listening to Working Lady podcast today. And I am so excited to talk about this topic. A lot of the times, we all have a lot of questions surrounding diagnostic testing. There's a lot of nervousness about it, and some of it's understandable, but I like to always ask questions and ask questions to the right people, the people who actually know the field and work in the field every day. So today we have Sean in. Hi, Sean. How are you today?
Hello. Thank you for having me.
I'm so happy that you're here, Sean. And can you give us your official job title and what you do?
So we go by the umbrella of medical imaging and radiation therapy professionals, but under that umbrella, you have over 11 plus modalities of tests you've probably had and thought they were a nurse. But I am a radiologic technologist, and I specialize in MRI scans and CT scans and a little bit of mammography.
I love it. I love it. Now, though a lot of those terms are things that we're used to seeing and hearing, but just so that we are having a clear, concise conversation, can you tell me why someone would need to get, for example, some of the tests that you specifically do?
Yes. So what I first like to clear up and make sure people don't get us confused with the radiologist. Mm-hmm. That is the actual specialist. He or she is a medical doctor, but they are the ones that read the exam. So your doctor will order maybe say an ultrasound, an MRI for an issue, and we, the technologist, actually perform those exams. Sometimes alongside the radiologist, sometimes independent of the radiologist, very invasive studies that usually a radiologist would do. But we have our own high-leveled radiologic technologist who can do what the radiologist can do, some things. And then you have the other specialties. So I can't wait to tell you all about that because I think it's going to surprise your audience what all we do and that we are like the third largest medical profession.
Absolutely. Absolutely. So, can you tell us kind of a day in your life? What is your daily duties and what you do daily?
So after 20 years of working in the field, my job has kind of changed over the years, but I'm going to give you a day in the life of someone who maybe just came into the field or who actively works direct patient care on a day-to-day basis, say a full-time job. And I'll explain to you how I do it a little differently because of my years of experience. And that just may open up options in your understanding of what it is that we do. So first, I went to school. Me personally, I went to a 2-year program up to a 4-year program. It was at Emory University School of Medicine. So back in the day, you could either learn it through the military, which you still can, just like nursing, you can learn nursing through the military. So you go to school for a minimum of 2 years for medical imaging. You can start in radiologic sciences. And then after that, the whole time you're in school, you're doing exams, you're studying for it, you graduate, you take your national exam, you get licensed nationally. Some states require you to get state license. And then you can go into diagnostic x-ray, which encompasses a lot of things just under diagnostic. So if I was a radiologic technologist, maybe your child has a broken bone or you have a cough and they need to see, is this pneumonia? Do you have any broken ribs? You're going to come in to me for a chest x-ray or a hand x-ray to see if you have any broken fingers or a broken hand. And then we're going to get those images over to a radiologist. If I did the operating room as a radiologic technologist, we're sometimes in the OR alone. So we work alongside surgeons that as they're putting in hip replacements, as they're putting all kind of things, whatever you can imagine as surgery, stimulators in the spine, we're there using live x-ray or fluoro, as they call it, fluoroscopy, which is a live view using radiation to make sure the doctor is placing things in the exact place he needs to. We have specialties such as MRI, which is something that I am able to do. I took an extra year of schooling to learn how to do magnetic resonance, which does not use ionizing radiation. It uses magnets. So I get patients who come in for any part of the body to scan. So some days I'll scan brains all day. Some days I do a mixture of everything. We do abdomens. We look at hearts. We scan hearts in MRI. We can scan pretty much anything. We scan prostates, we scan everything, breast, we do it all. And that's my day pretty much is operating different machines, So sometimes I'll operate MRI Siemens, MRI by General Electric, Philips. So we have to know all of these different machines. And you have to understand radiation biology, how that radiation could affect someone's body. And every person is going to be different. So we have to employ biology when it comes to radiation. We have to employ physics in MRI because we're using a magnet. So we are employing the magnetic physics. So we have to employ mathematical formulas and things like that. The machines do a lot of it. We also put in IVs in a lot of the radiology exams. So I'm used to working alone because I am a contract worker, which means that if a hospital is short-staffed, we go in and we work for that hospital, whatever shift, whatever period of time, usually it's 13 weeks. They need some help, and we'll work as a CT tech, MRI tech, nuclear medicine scan tech, a mammographer, anything that they need. And we take care of those patients. We put in IVs, we inject contrast. We inject contrast rectally. We inject contrast through the veins. We have people drink contrast. Contrast can go any way it needs to for us to see what it needs to see. We also, one thing I just covered on my social media, some days I do dephograms. Have you ever heard of a dephogram?
I have not. I would love to know what that means.
Yeah, most people don't know that we actually doing MRI can watch the MRI live. So what we do is put ultrasound gel in the rectum of the patient. And it's usually people who have either like fissures, like a tear in the rectal area that leads into the vaginal area, which you want to be careful because those contents should not mix. Or they've had some kind of surgical procedure that's torn, pregnancy, childbirth, things like that. Excuse me. So patients need, or they're having pain, anal pain, any reason like that, or they cannot control their bowels. The doctor may order a dephogram, which we put ultrasound gel into the rectum. And during the MRI scan, we want them to defecate the ultrasound gel out. So that way we can see, is it going in the right place or is it going somewhere else? So we do a lot of different exams. And that's just kind of a nutshell. I do CAT scans, which is radiation. We do biopsies. A lot of people think we just take a CAT scan and take a picture, but we are in the room doing live biopsies. Say if you have a mass on your kidney, they don't want to take you to the OR and just do surgery and cut your kidney out. So what we do is we put you under CT radiation and we do it live, and we can pinpoint exactly where that mass is. And the radiologist goes in with a very small needle and pulls a piece of that tumor out for a biopsy. And we're there to assist. We operate the machine. We help the doctor put the biopsy and everything together to get it sent off to the lab. We do a lot of things that people just really don't think that goes on in medical imaging that they get done every day.
Well, first of all, I want to thank you for the work that you do. I feel like the healthcare workers, guys, we have to give them props, guys. They are saving lives. They are helping us figure out issues and doing a lot of preventative work. You know what I mean? If we go for these regular scans and we do what we're supposed to do, I mean, you cannot, the times in my life where I've been in the hospital and you see how people are there taking care of you. Nobody goes into this field without a love for human beings, okay? And so we have to respect these people. There's a lot of toxic talk out there surrounding healthcare workers and surrounding, oh, this and that. And it's too much. They have, they're here working for us, and we don't want to make their jobs hard when we go up in there. We need to listen to them and value, these people have gone to school for this. So let's now kind of talk about some of the things that specifically face our community and the Black American community of, the diagnostic testing and being afraid to get some of these things done. I will talk about one thing that I always hear, and this one may even be across the board, with other groups of people too. But a lot of people are afraid of mammograms. So
Yeah.
you are able to perform mammograms. Some people say, the radiation is probably causing a problem. It might cause a problem down the road. Now, I've done a lot of research on this myself because it was something that, back in the day, you hear about, your aunts and your moms, they're getting these things done. And we're all going to be in that position where we need to get these things done. And I was actually pleasantly surprised with the information that I found. But I would love for you, let's pretend I'm a patient and I'm coming in and I'm like, I don't want this. This is going to be more radiation. This is going to be harmful to me. What can you say to me that is going to help me?
So what I do, I don't do I did screening mammograms for a long time, which I actually every year in October, I do a whole month dedicated to breast health. I come from a family, 5 aunts passed away of breast cancer. My cousin passed away in her 30s of breast cancer. Another cousin passed away in her 30s. I had my first lump at 21. It was not cancerous, thank goodness, but at 24. Ever since then, I've gotten breast ultrasound since the age of 24. And once I hit 40, I started getting mammograms. Was I scared? Yes. I've been there. I understand. Nobody wants to hear the word cancer. I deal with patients all the time. At MRI, we actually do breast MRI on a very routine basis. And a lot of times it's when you've gotten to the point of this is not where you want to be. It's at a situation when you get for the MRI, and it might be for genetic testing, you're getting it done, but most people that come to us for breast MRI, they've got cancer. And the younger they are, it's bad. And the conversation that I have with my patients is you can prevent better than you can treat. And a lot of things go into, for me, my first lump, I felt like I was doing everything right. I was like, well, sometimes it's just genetic. Sometimes it is genetic. I mean, you can't stop certain things, but what you can do is prevent. And cancer treatments have come so far. I've been in this field for 20 plus years, and my first job was in a cancer center doing CAT scans. And when I tell you what I see now being done in the field with the advancement of medical imaging and cancer treatment and many other things, a lot of things are preventable. A lot of things. And I would tell you that my family members, those were preventable if they had gotten the checks that they should have gotten. My grandmother passed away of ovarian cancer. It was preventable. She just didn't want to go. She was that generation, didn't want to go to the doctor when she saw something. And I tell my patients all the time, it's better to know. Being silent about something and suffering when you don't have to suffer and lose your life is no excuse. I had a podcast during my month-long breast cancer awareness that I do every year on my podcast. I have breast specialists come on, radiologists who are breast specialists, technologists who that's their main thing is breast health. And the one thing they say is one lady, she owns a mammogram bus. And she and some doctors and community leaders got together. They went out to the underserved areas, scheduled them to pick them up to take them for their exams. People just didn't want to go. They wouldn't find the time. And I think we just have to educate. So she saw that it wasn't an issue of they couldn't get there. It was more of they didn't want to. So what's the reason? Like you said, fear. Fear of this is going to hurt. There are some things that I tell patients. If you're just coming off your cycle, your breasts are tender, don't get your exam around that time. It's some basic common sense things that we all can do. I don't get my mammograms around the time that I know my breasts are tender. I don't. I just don't. Why do it? Right. Also, I find a place to where I'm comfortable with. Mm-hmm. I've only been to 2 places that I've gotten mammograms done. The first experience, I didn't really care for the technologists. They were a little rude. I'm being honest. I'm telling you, they were a little rude because I didn't just do what they told me to do. I'm going to ask questions. I tell people all the time, ask questions. If you're not comfortable, voice that you're not comfortable, whatever it is. As healthcare professionals, we need to respect that. And people are fearful, and that fear shows in different ways. My job is to help you to bring it down, calm down, get the rational side of it. If you need to reschedule, come back another day when you're in a better frame of mind, do that. But just come back. But find a place and a group of technologists that you're comfortable with. And I go to the same place every year. I usually have the same young lady that does my ultrasounds. It's just being comfortable because I remember getting the news that I had a lump. I remember finding it on my self-exam the second time. I've had 2 or 3 lumps. Only one has had to be removed. So that's why I tell people, I understand. I've been there. It's scary. Every time I go for one, I'm thinking, okay, what are they going to find this time? Because I always get called back for the ultrasound after the mammogram, because if you have dense breast, things are hard to see. But when it comes to the scare of radiation, I've worked around radiation for 20 years. Mm-hmm. The earth gives off radiation.
Yes.
Humans give off radiation. That microwave you warm your popcorn up in and your pork chop in, that gives out just as much radiation. You know, the TV that we sit in front of and watch, the 6 o'clock news, the 12 o'clock news, the 7 o'clock news, the 8 o'clock, the cell phone, we get more radiation from stuff that we don't even think about. That's harmful to us.
Right.
When it comes to radiology, they have gone to great lengths to create machines. I just toured, we have a radiology museum in New Mexico. There's one in Germany as well. And the stories that you hear of early people who were pioneers in radiation, how they lost their lives, lost limbs because of radiation poisoning, because they did not understand how dangerous it was. Mm-hmm. Now we have the technology to where we make sure that when we do exams, we collimate in. If I'm doing your C-spine, I am only radiating this part of your body. I close in that light to make sure I'm getting the anatomy I need. Because not only the radiation I'm delivering, but also when radiation hits your body, it bounces off. It's called scatter radiation. That's why we don't let anybody else come in the room. That's why we don't stay in the room. Because when it hits the board or hits the patient, it bounces, the extra bounces off that's not absorbed into the patient. Mm-hmm. Mm-hmm. So what we want to do is make sure we minimize how much scatter bounces off the patient. Because we're only getting that little area that we need. And when people go to school for what we do, and I like to say this because I'm running a whole series now, because there are people out there taking x-rays in certain cities that answer phones. They're receptionists. They're not radiologic technologists.
That is unacceptable.
Some states are not licensed. And there are people that answer phones and have no background because people assume we just press buttons. And that is my purpose for being on social media, is to really educate the public. Who's doing your x-rays? Who's doing your nuclear medicine? Who's doing your radiation therapy? Who's doing your... Most times in a hospital, they are registered. The hospital has Medicare guidelines and stuff they have to follow.
Right.
But when you start going to clinics and chiropractor and other things like that, you need to ask, are you a registered radiologic technologist? Do you have your ARRT? That'll tell you if it's the receptionist or not.
That is, I'm so glad you said that, because I'm very picky about that. And for my nutritional health coach clients, I'm always telling them to stay, because we have this thing in society now where everybody's kind of avoiding big medicine, like, okay, have your baby at home, don't go to the hospital for nothing, the hospital trying to kill you. But when you leave that safety net, there's a lot of regulation that happens in the hospital settings, so you're going to get a actual certified technician, versus if you're going just to some small, center around the corner that's privately owned and privately funded. Well, guess what? Now you're outside of that window of protection. So again, we just have to navigate these things and understand these things, because sometimes, and I'm not knocking all of that, but I'm a person who is now embraced a dual, a more of a two-way approach, and not shunning all the healthcare people, shunning all that. There's some good in those other sub communities, but we cannot discredit. You mentioned the movie. You mentioned the pioneers of the radiology field. I recall watching a movie about a woman. I forgot her name. She was a Polish woman, and she was key and instrumental.
Maria, I forget her last name. Maria something. I can't remember her last name.
Yes. And yes, she did end up losing her life. She did die, at an advanced age of cancer. And then, see, I'm almost kind of like a numbers person, in where I want to look at numbers and look at an overall thing. So this woman had been working with straight radiation, unprotected, for at least 50 years before she got cancer and died. So should we really be freaking out about diagnostic tests? That gives you an idea of how much exposure, and it's going to be different for everybody. But as a whole, those are some pretty good odds. I mean, you know what I mean? It was not until at the end of her life that she ended up getting cancer and dying from that. And that was direct exposure.
Direct.
All day, every day. So we can't keep falling for these conspiracy theorists, guys, who are pushing this mess into our communities and making us afraid to get these diagnostic tests done.
And they even have 3D mammography. Like when I was first starting, it was like 2D, but now they have a 3D. People get 3D ultrasounds. Look how detailed those babies are. Like, you can see. Yes. So that cuts down on how much radiation they need to use as well when they do 3D. I try not to get too sciencey, but I just try to relate it to something
I
people.
love the science.
Yeah,
We on
I think
it.
about people who are listening. Like when I deal with my patients for MRI, they want to know, how does that magnet work? It's a whole science, hydrogen molecule. Most people, they gonna get lost after the first 30 seconds. I'm like, look, it's just a bunch of magnets. When you put the magnets together, another magnet repels They understand that. So I'm like, well, your body got hydrogen molecules. So the reason you're dizzy when you come out is because normally hydrogen molecules in your body, they just dance around, move how they want. But when I put you in the middle of that magnet, it's just like two magnets. Now all of a sudden, all your hydrogen molecules got to stay straight, and they're forced to stay straight. So now you're getting hot because your body is not in its natural state. You're feeling kind of woozy. And then when you come out, everything's back to normal. Now that's why you feel so exhausted and hot and kind of off kilter. And they go, "Oh, that makes sense." Yeah. I
love
think
it.
just explaining things to people a basic way. And when it comes to your breast ultrasound, we don't need that much radiation. We understand that the breasts are very sensitive. The breasts don't have bone that we need to get through. Like when we take x-rays of bone, we need to increase the power, of course, to get through it. The breast tissue is soft. It's fluffy. I don't care what size they are. They all fluffy. It's really soft tissue. You don't need a lot of radiation. There's not any bone that we need to go through. Bone is extremely hard, like cement hard. Of course, we need more power to get through it. A pelvis, we need a lot of power to get through a pelvis. We don't need all that with breast tissue. So that's why it's really quick, really painless. The compression is not hard at all. I find when I do screening mammograms that people don't understand what all the breast is. And this is what I love to do these breast cancer awareness videos, because most people think the breast is just the piece that goes into your bra. Well, your underarm is part of your breast, up to your collarbone.
Yep.
All of that. Your lymph nodes, we look at the lymph nodes. When we take breast exams, we look at the lymph nodes. We don't just look at the tissue. We look at the nipple. So when you're home and you're taking a shower, you should be looking at your own breast. So I tell people, the first thing, if you're waiting on a mammogram to catch something, I caught both of mine myself. And it was a pea size, because I knew my breast, because every month, sometimes twice a month, I make sure I check them. You have to look at them. You got to check them. You got to know what they look like, what color they are, when they this color, when they this sore, what soreness looks like, and when it's not sore, what that feels like. And if you don't know that, start today. And then make your appointment on an easy day to remember. Some people do it on their birthday. Some people do it on their wedding anniversary. I do it in October. October 1st, that first week. That way I know it's Breast Cancer Awareness Month. I'm not going to forget it. I just get everything done when it comes to my breast health in October. It's like, do whatever works to make, and then make it a fun thing. Me and my mom will call each other. Did you set your mammogram up? Did you set your ultrasound? Okay. Dress in pink, have a party, have a mammogram party. You and your girls get together, go get mimosas afterwards. Do something that makes it fun.
Off.
Yeah.
Right, absolutely. So I think we kind of touched on it a little bit, but again, just to kind of drive the point home for our community, should we at this point in 2024 be afraid to get mammograms?
Oh, no. The advancement of it, the radiation is so minimal. It's so minimal. I mean, it was a concern of mine as well when I got my first mammogram, because I'd always gotten breast ultrasounds. And my argument and I sat and talked with my doctor, and I do radiology for a living. And I said, hey, you're going to send me for an ultrasound anyway. Why are you having me get this mammogram? And I have a great doctor. That's the other thing. Get you a really good doctor. If your doctor don't have time to spend with you and talk to you, I mean, you can't hold them up for 20, 30 minutes. Sometimes they just don't have that time.
Right.
They have a life too. They got to see a certain amount of patients. Most doctors don't even own their own practice.
Right.
They have to move through pretty quick. But a good doctor is going to answer your questions. Go prepared. Don't repeat something you done heard somebody else say, where I heard if they squeeze it'll bust the mass in my, if that's your concern, that's your concern. But write down your concerns. Go in there with a piece of paper and say, hey, doc, I need 10 minutes of your time. I got a few questions before this exam that you order. These are my questions. Write down the answer. Ask them, can you record them? Because you're not going to remember what they said. Most doctors wouldn't have a problem with that. And go in prepared, come out with your answers. Once they're answered, go ahead and schedule your appointment and find a place that works for you. Find a date that's good for you. I say get it done in the morning. before you're all stressed out and have time to back out of it. And then just make it a regular thing and center it around something fun. But you have no reason to be afraid because of the radiation. I've been doing it for 20 years. I have been caught in a room sometimes with CAT scans, which delivers way more radiation than than mammograms. And I've been stuck in a room sometimes by mistake and got radiated several times. I've done fluoroscopy exams in the room with live radiation. My husband works in an OR for the last 18 years, live radiation. And neither one of us, you can't control anything. But what I tell people you can control is once you know, now I can do something about it. If there ever is something. Right. And many times it's not. It's usually from something else.
Exactly. And that's my whole point. I just want people to get into the idea of logically working through in your head, okay, that benefit risk assessment. One analogy or example I use when I coach my clients with their health, and I encourage them, don't forget to get your vaccines for your, your HPV and all the childhood vaccines and all that. Because some people say, well, I'm afraid of the, the this or the that in the shots or the alcohol in the shots. And I go, do you drink tequila? Well, guess what? There is way more formaldehyde in tequila than there is in your vaccination. So you've been chugging them tequilas, right? And those have not took you out, in one go. So you are good. And so for you coming on today and sharing with us, hey, I've been in the room and I've been radiated. I've been doing this for X amount of time and you're working in the field, it gives people kind of that metric in their mind. Okay, because the average person is thinking this is something different that I've never encountered before, which is not true because you're getting radiation from the earth around you just from going outside. You're getting radiation from your microwave. You're getting radiation in all these different ways all the time, and your body's very adept at handling it. But then, they need to understand this is a controlled thing. This is something that has been studied. There is a lot of research and preventative measures in place, and you are getting a minuscule. I always tell people, focus more so on what you're doing on daily. Do you eat fruits and veggies every day? That is going to benefit your life, and is way more important than worrying about some radiation you're going to get from a machine. And this is something I've had to go through myself.
Yeah.
That's why I'm so passionate about it, because for years I was terrified of it all.
Yeah.
Thinking that I was going to get something from the test, but you're there for a reason. You're there because something's already off, right?
Yeah. Because I'm going to tell you, I did radiation therapy for a few weeks trying to decide if I wanted to do it. Radiation therapy is when someone has, say, throat cancer or breast cancer. And sometimes the chemo is not a good fit for us, so they get radiation treatment to target that specific area alone. That's some high dose of radiation. And for most people, it doesn't kill them. It does not kill them. You have to be really weak. But that even is a very safe dose, if you want to say safe amount. But that is one of the highest doses of radiation that we give to patients. But it's for a reason. A medical physicist actually calculates each treatment for each patient, and in those 12 or 6 weeks or however long the treatment is, that amount is calculated specifically for that patient. They have a certain little cage that they use, and on that cage is a mark where, say if it's throat cancer, there's a mark on there because the mark has been fitted to that patient where their tumor is, and each time that tumor shrinks, they refit them, remark, and deliver a new dose, because as they're shrinking it, they can't use the same amount of radiation to a tumor that's been shrunk. Right. And it's probably moved. So now, and that's what I use that example for people to understand. Nothing that we do in medical imaging is to harm you. I got patients that come for CTs every 6 months, CAT scans every 6 months, because it's a cancer follow-up. Now, they've gotten rid of the cancer. They've gone through their radiation treatment. They come back every 6 months for 5 years, 10 years, however long the doctor told them they got to get 2 CAT scans a month, some people 3. Do you think those people worried about how much radiation they're getting? They want to live.
Right.
So would you say, well, doc, how much radiation am I getting in these 2 scans a year? Doc, like, I mean, we can not give you any and wait to see if something happens. And then now once we do your next CAT scan, we might find something. Or we could just scan you with the minimum amount of dose, make sure there's nothing growing back, make sure there's no issues, and just watch it for the next 5 years till you're cancer-free. Majority people take that route because they understand that the possible risks don't outweigh the benefits.
Exactly.
So that's what I tell people. You can live your life afraid of the what ifs, but I'm going to tell you it's a reason that we are higher on the list for people that die of things that other people don't die of, because they go get their checks. They make sure their health is up to par. They don't. And I say it's good to listen to people, but be careful who you listen to, because everybody's experience. I get this in MRI all the time. People come and they've watched House or they've watched another TV show that depicts MRI as this scary thing that's a tunnel and it's the music and it's just awful. But when they get finished with that MRI scan with me, they're like, this wasn't bad. This was because I got the eye cover, I got the music, I got, I let you lay there, I spray a little lavender in the air. I turn the light down. I talk to you, I ask questions. We want you to get the exam done safely, get it done accurately, and your experience to be one to where when you leave out of there, it's totally different from what somebody told you. Or what you saw on TV. TV is TV. It's entertainment. It is not real. And sometimes other people's experience is that their experience, and sometimes it's exaggerated. But it doesn't have to be yours. So I tell people, take your power back and take care of your health. Educate yourself on different exams, because we do so much out there that even we're educating nurses and doctors what it is that we do, because we are one of the third largest medical professions. And most people have gotten one of our exams and not even known it.
Yeah, and I would just say too, guys, the National Institutes of Health put out some years ago a graph that was once I saw that graph, it put it all in perspective for me. And I really have not been so fearful of getting diagnostic testing done. And it basically shows you, it's like, okay, you could have X amount of x-rays in your lifetime, and it was something like 100,000 or something like that before you would start to become. And then it was like you could have X amount of mammograms, you could have X amount of CT scans. The mammograms and the CT scans, the recommendation is less. It might have been like 60 or something like that, don't quote me, but they are quite high. And they worked out all that math and worked out all those numbers. So I would really encourage you guys, go on National Institutes of Health, look at that graph and get familiar with it, so then you are not so afraid to get these diagnostic tests done. Because the whole point of what we're saying today, and then we're going to sign off of here, is you need to get these diagnostic tests done, because they are not as harmful as people are making them out to be, or I dare I say not harmful at all. What would be more harmful to you is to not get these tests done for fear of radiation, and then now you've allowed something that was this big to grow into something that's this big, and now it might be untreatable. So it's all about prevention, and you want to have a qualified professional like Sean here in your corner. Be nice to them when you go in. I remember a place that I used to go, and it's like I would see the one and they were like, "Oh, hey," she like, "You here, Gail? What you here for?"
Yeah.
This and that. Be comfortable with them. And then what I have noticed is when you get comfortable with the professionals, they will then be able to explain you more. And when they see that you trust them, you are going to get a whole different demeanor. You know what I mean? You're going to get, the red carpet treatment. Now, everybody's getting good treatment, but
Right.
you might get more of your questions answered and feel more at ease.
Yeah.
So Get your tests done, ladies. Get the mammograms, get the pelvic exams, get your x-rays, your CT scans, whatever the doctor is ordering. Do not worry about the radiation. Do not fall for this stuff that you're seeing, and get the tests done. Now, are we saying just get them done willy-nilly? Because that's something else that I be seeing. I got one friend every 5 minutes. Let me get a CT. I'm like, girl, yeah, you
You take it
good.
into another level.
You're doing too much. So we're not saying do that either
Right.
if it is asked. But don't if your doctor don't think you need it, you can always get a second opinion. I advocate for that. I basically got two doctors for everything. If they say the same thing, then I know I'm good. So but if
Girl.
the doctors are telling you you need it, get it. But if both of them are saying you don't need it, then don't get it. You know what I mean?
Yeah.
You don't want to be doing tests for no reason either.
And let me say this, men should get mammograms and do breast exams too. It's going on a rise. Male breast cancer is on the rise.
Oh my goodness.
And the other thing, we do a lot of prostate exams. I remember I worked at one hospital. I'd never done so many prostate exams in my life. Something about that demographic. And it was African American men. So women out there that's listening to this podcast, make sure your husband, you do it to your husband, just check his chest. We rub on our men all the time. So, check his chest. He don't need to know what you're doing, but help him to understand that male breast cancer is on the rise. And also, men do not want to get prostate exams. They will be 70 years old and never get their prostate checked.
Oh
And
my goodness.
we
What
get a
risk.
lot. And you can tell by the blood work when your prostate is not working. Right. You don't have to wait till it gets totally like a grapefruit. It's a problem. And it may not be cancer. It could just be inflammation of the prostate, which is a problem too. You should not have inflammation in your prostate. The prostate should be, it's a gland that needs to be working right. And as if you got a husband, make sure that you stay on top of them getting their exams as well, because we do MRIs of the prostate, we do ultrasounds of the prostate, we do many exams of the prostate, but you don't want it to get the nuclear medicine and those other things by the time it's cancerous. So get your blood work, get your physicals, just have a routine. That's what I like to tell my patients. Have a regular routine of preventative care. We always talk about health care. I preach preventative care, because if you prevent something, you don't have to be surprised. You don't have to be scared to go get this exam, because you know what? I'd be shocked if something wrong with me. I feel so good because I've been taking good care of myself. I've had my blood work. I had my physical last year. I've done my own breast exam. So I'd be surprised, or you'll be really in tune with your body that this is not a normal headache. Let me go see what this is. But if you always got a headache because you're eating fried food or you smoke or you won't exercise, then you're just going to ignore it and just chalk it up to be that's just how I normally feel. And I always tell people, it's something to when you feel good. I don't know how to tell people how that feels, but when you feel good on a consistent basis, you save a lot of money, save a lot of worry, and it's just a good feeling to feel good. And I think everybody deserves that. So I appreciate you doing this podcast, having us on, because we're an essential part of healthcare. Sometimes we get overlooked and people don't really know who we are, but people need to know who we are, because they need to know. Go get that ultrasound if you're scared of a CAT scan's radiation. You have other tests you can get. We have, I'll quickly run down. We have radiologic technology, diagnostic x-ray that uses radiation. We use ultrasound that doesn't use it, uses sound waves. It's not as clear on certain things, but it can be a baseline. It could be a starter. If there's something there, it's going to most likely show up on ultrasound. It's a little cheaper. It's quicker to get. It's ordered regularly. You got CAT scan that uses a small amount of radiation as well. We have MRI, which is no radiation. It's more expensive. It's not going to give you the same thing as CT. So if you're having generalized abdominal pain or just a headache, you don't necessarily need an MRI. A CAT scan will show you that versus an MRI. MRI is more for if you got a brain tumor, if you have a cyst on your liver, something we know that you have. MRI is there to give the detail, to really help us to really make out the detail of it. That's what MRI is good for. They're starting to just order them like they're CAT scans and x-rays, but it's a total different exam. You got PET scan, nuclear medicine scan, which is, again, once you have an issue or they do stress tests, maybe your heart needs to, and that's part of some people's physical. We have radiation therapy, but again, that's when you have an issue, you get radiation therapy. Those are things that are way more advanced. Then we have a radiologist assistant, which you've heard of a physician's assistant. You can see them instead of your doctor. Well, we have our own RAs, which assist the radiologist. They do some of the same things a radiologist does, which is our doctor. The doctors are they're busy, they're overtaxed. So who have a lot of years of experience go get a master level degree and become RAs, radiologist assistants. So sometimes they'll be doing your placing ports, placing grafts in your arm, certain surgical procedures a radiologists do. They'll be doing injections into the joints, like an arthrogram. If you have a torn labrum, we'll inject contrast into the joints, the radiologist does, or the RA. What other? Mammography. We have bone density. So when you're over 50 and you start getting osteoporosis, or they want to check to make sure, you get bone density. All of those, that doesn't deal with radiation. Mammography has a small dose. And I think I covered everything. I think I got everything. I think I got everything.
No, I want to thank you so much for coming on and sharing, what you do and how important it is, to understand all the different tests and understand all the different fields, in the radiology field as well. Ladies, I hope you will, listen to this on the go, listen to this in the car, and get this information. One last thing before we go, could you please drop your social media channels, because she's posting, information around these topics on her social media that you guys should definitely connect with.
Oh, yes. So I am on all platforms, a couple of rad techs. Just like I spelled out, a couple of rad techs. You can find me on YouTube, Instagram, Facebook, TikTok. I'm very active on social media, and LinkedIn is my name, Chandria Singleton, but you can get my links from any of those other pages and just click on them and go. So follow me over there. I try to give content that on each of those platforms. The LinkedIn is more educational, but the others are entertaining, educational. I try to make it fun as well and lively.
I love it. I love it. All right, guys. Well, hey, I want to thank you so much for listening to Working Lady. I want to thank you so much, Sean, for being here today. And we will see you next time.
Thank you for having me.